Dementia care can be a daunting experience to someone who hasn't experienced it as of yet, but whether you are just starting to care for a loved one who has been diagnosed with it, such as Alzheimer's, or any other type of memory loss, it's important that you have all the information in front of you, such as knowing where dementia care facilities are in your neighborhood and what type of care they provide, amenities, pricing, and services. This will help your loved ones find the right type of care for their specific condition. What is dementia? Dementia is not considered a disease, but it is a term that encompasses various symptoms, such as loss of memory, reasoning, and thinking to the point that the patient's day-to-day activities have been compromised. Other symptoms that may appear include changes in behavior, personality, and mood. When certain parts of the brain, especially those involving decision-making, learning, language, and memory, get affected by various diseases or infections, dementia may occur. One particular trigger is Alzheimer's disease, but there are other possible causes as well, such as depression, chronic drug use, and vascular diseases, among others. Dementia is essentially irreversible, especially when it is triggered by trauma or by degenerative disease, but there are instances where it can be corrected, such as when caused by depression, drug intake, imbalances in vitamins or hormones, or excessive alcohol consumption. Therefore, it's important that the symptoms be evaluated by a professional to determine the proper treatment, especially when dementia is in its early stages. Forms of dementia. There are different types of dementia that may befall the elderly, including Alzheimer's disease. This is the most common type of dementia, afflicting 60 to 80% of dementia cases today. The early signs of Alzheimer's includes short-term memory loss and bouts of depression. Depression overall, however, is not typically associated with Alzheimer's and should be treated accordingly. Parkinson's disease. Those who have advanced stages of Parkinson's disease may have dementia, which can be detected when the patient has problems with judgment and reasoning, making them irritable. Vascular dementia. Vascular dementia is caused by not enough blood flowing to the brain and may occur as you age, and at times this may be linked to strokes. The symptoms for vascular dementia may occur slowly or sudden-like, depending on what triggered it. Usually, a patient becomes disoriented or confused, typically the first signs to appear. Later, they may have difficulty completing tasks. How to care for someone with dementia. Here are a few tips to consider when dealing with dementia. Empathize. If you want to be an effective caregiver to someone who has dementia, you need to show compassion and empathy, as patients with dementia tend to become confused, and waking up in strange surroundings can be a frightening experience. More than memory loss. Memory loss is a common symptom of dementia, but there are some instances, such as in the case of Pick's disease, where personality changes may occur. Even if memory loss is not yet apparent, neurological decline can still occur. You will need to be ready when this happens and be more patient. Support is needed. It's hard to care for a dementia patient on your own, especially if you are not an experienced caregiver. But if help is offered, take it. Seeking help from support groups, family members, and healthcare professionals can help ease the workload. Plan ahead. Caring for dementia patients requires professional assistance. Therefore, finding the right facility for a loved one at the right price is a must. Memory care home. Many memory care home facilities offer residential long-term care. However, it's important to know that not all nursing home care facilities provide sufficient care for patients with Alzheimer's disease or other forms of dementia. In the early stages of dementia, many patients are still capable of functioning on their own, and they are able to live in retirement or care facilities on their own. However, for those who are no longer able to care for themselves, memory care and assisted living facilities are the best option. What to consider in dementia care facilities? It takes considerable thought when choosing the right facility for a loved one. Consider location, quality of services offered, and cost of care before making any decision. Quality of care. When choosing a facility, ask questions of staff and management, and don't hesitate talking to the residents as well. Be diligent. Check to see if there are any hidden costs to consider, such as for placements or down payments. Familiarity with dementia. Quality of staff is of utmost importance, so ask about credentials. What type of training do they have? What type of security is practiced? And what level of activities are offered? Family's involvement. Don't hesitate asking if family visits are encouraged. Are visiting hours too restrictive? And are unannounced visits permitted? Assisted living residences. Dementia patients in the early stages of the disease may benefit by living in an assisted living facility by getting intensive support through the use of instrumental activities of daily living. These are basic activities that we practice every day to improve our memory. Here are a few examples. Preparing meals and snacks using kitchen equipment. Managing money by keeping a budget or handling cash and checks. Doing household chores. Shopping. And managing medication intake on their own. Other tasks include taking a bath, dressing and grooming themselves, eating, and even controlling bowel habits. Patients who are in the middle stages of the disease may find assisted living residences to be beneficial, but a private room may eventually prove to be more appropriate. Memory care facilities. Memory care facilities offer additional security measures over assisted living, such as not offering individual kitchens due to safety concerns. Memory care units are also designed to provide patients with a relaxed environment. This is normally done by gathering residents in rooms where there is plenty of natural light, rooms that come in bright and happy colors to keep them upbeat. And because patients with Alzheimer's often lack any appetite, there are some facilities that incorporate fish tanks displayed in the dining area to help stimulate their patients' appetites. Proper lighting and decor help create a positive environment. A fish tank scattered here or there doesn't hurt. Staff on hand is an important consideration as well. Each state has regulations on number of staff to patients residence ratio. In Oregon, residential care facilities are required to submit a quarterly report with staffing data showing the actual numbers of nursing staff on hand to care for residents per shift. Another main difference between assisted living and memory care is the skill level caregivers provide. Although both require staff to assist patients, those in memory care are also trained to handle the special demands dementia patients require. The training they receive includes understanding how dementia manifests, how to handle disruptive behavior situations, and how to better communicate with their patients. In summary, choosing the right facility for a loved one is a challenge for sure. Taking time to explore all the options is crucial to the process, so choose wisely for peace of mind for both yourself and your loved one.